Lateral hip pain can be caused by 5 different things. 1, arthritis of the hip joint. Now, when people get older and the hip joint starts to go, certain movements become difficult. So one is they begin to be difficult to turn their leg in, so away and turning the knee inward. When you need a hip joint replacement, you can't do extension, so the person limps. And the way you test that is the person's lying on the table, face down, and you lift their thigh. It's like a rock, you can't lift it. And that's why the person is limping, they cannot extend their leg while they're walking. Second one is the Tensorfascelatada muscle that's right on the outside, the lateral side of the hip. And that particular muscle helps you to stabilize in walking. And it also moves your leg out to the side. And the way you test it is you put your hand on the ankle, not your foot, you put your hand on the ankle and you push out, and it's going to hurt right on the outer side of the hip. Number three is the gluteus medius. The gluteus medius takes the leg to the side when it's slightly back. It also helps you stabilize in walking. So to test that, you have the person lie on their side, bring their leg back about 8 or 10 inches, and try to lift up as you hold their ankle down. Gluteus medius, very common injury along with back problems. Number 4, trochanteric bursitis. You have the person lie down on the floor, and on the greater trochanter, there's a little bursa right on top of it. You just touch it, it's going to be painful. And if you have the person lie on a wooden floor, hard floor, tile floor, it's going to hurt just to lie there. And number 5 is the ilio-lumbar ligament. So if you put your hand right on your hip, right on the top, that's where your ilio-lumbar ligament is, and it often refers pain to the outer side of the hip. It also refers to the groin, different places across the low back, but really to the outside of the hip. So those can be confusing. I remember I had a runner come in to see me, and he had to run for 30 minutes for him to start having pain. He was a powerful guy. So what you do is you say, I want you to come in next time and run for 30 minutes and time it so you run into my office, and then I can test you because I want to be sure that's what you have. And that's what he had. We treated him. He was able to run a marathon. He was ecstatic. But you can't find something unless it appears. And if the person says it takes me X amount of time of doing something to hurt, have them do that. Then come see you. In the Anatomy and Action subscription, we have a whole module on the hip. All of those things I talked about are covered throughout our course. So we have 9 other modules covering the rest of the body. And if you'd like to get a subscription to go through our entire program, just press the link that you see in the description. And I hope to see you there. And I will see you in the Q&A once a month. I meet with you so that you can ask me questions in person if you're having a difficult case or you're having something you didn't understand when you were watching the training videos. See you then.